Good evening, everyone. I welcome you all on Homeopathy 360. I am Dr. Noori, Senior Editor at BJAM. It is with great pleasure that I welcome our esteemed speaker of the day, Dr. Nayeemunnisa Begum. She's Professor and Head of Department of Practice of Medicine at HKES, Dr. Malakaradi Homeopathic Medical College and Hospital, Kalaburagi, Karnataka. She has organized numerous CMEs and workshops, as well as various free health camps. She has contributed as an assistant editor for the RJAS Journal of Ayush Sciences and continues to participate actively in faculty development, curriculum design, and examination duties under RGUHS. She is also president and member of National Association of Palliative Care for Ayush and Integrative Medicine. In today's webinar, ma'am will talk about complications of womanhood and homeopathy, where she will discuss the prevention of women's instabilities in various stages of their biological evolution and its homeopathic aspect. Ma'am, we are absolutely delighted to have you with us today.
Thank you so much. Thank you, Dr. Noori, for fabulous introduction of mine.
Pleasure is all ours.
Thank you. It's a great privilege for me to be a part of this webinar and this Organ on Master series. Thank you. So shall I start sharing?
Yes, please, ma'am. While
Yeah.
ma'am is sharing her presentation, I request the audience, if in case you have any questions, you have a Q&A box you can see in the Zoom that you can put your questions and we'll try to take up in the end of the session and ma'am will answer them. Yes, ma'am. Digital
Yeah.
stage is all yours.
Thank you so much. Good evening, all. Is it all visible, audible?
Yes, ma'am, we can see that.
Okay, thank you. So, Assalamu alaikum, Namaste, Sat Sri Akal, and hi everyone. First and foremost, I'd like to personally acknowledge Dr. Noori Ali for this invitation and a fabulous presentation of mine. And I'm thankful to Homeo 360 for inviting me to this webinar. Before I begin, let me pay a humble tribute to our scientist of scientists, great master, the visionary scientist, Dr. Samuel Hahnemann. Paying tribute with his second aphorism, the highest ideal of cure is rapid, gentle, and complete restoration of health by most trustworthy and least harmful way. And let us day to day remind ourselves with these three important aphorisms, the first, the second, and the third aphorisms. So today here I am presenting complexities of womanhood and homeopathic intervention. Next slide. माँ के कदमों में जन्नत होती है. Strong woman is not recognized by attitudes. Rather, she is recognized by standards. So in Sanskrit, there goes a saying, Yatra naryusta pujyate ramante tatra devate. Arthat, where women are honored, there the gods delight. Women are considered supreme in almost all religions. Women undergo various phases of transitions in their life. So this is marked by puberty and reproductive maturity, pregnancy and postpartum, climacteric and menopause. While passing through these transitions, women are likely to undergo instabilities in terms of their physical, emotional, hormonal, and social domains. At the level of physical, they may suffer from fatigue, menstrual irregularities, and body changes, emotional mood swings, anxiety, and depression, hormonal changes in the form of endocrinal fluctuations and irregular cycles, a stress from the society, from the peer, from the family, coupled with work responsibilities. So these instabilities during the transition requires a holistic approach. Besides, a preventive management of these instabilities would make a holistic journey of a womanhood. The prevention of women's instabilities in various stages of their biological evolution is possible through a balance, that is homeostasis, and maintenance of self-regulation, which is also called the life force. What does homeostasis means here? It means that it's an internal environment of an individual. In spite of changes in the external environment, the internal environment, that is the physiology, remains at equilibrium. So here, the physiology, I mean that the temperature regulation, the blood sugar levels, the pH balance, the water and electrolyte balance, and the hormonal balance, they all remain in an equilibrium. And it's an auto-regulation, an inbuilt capacity of an individual to carry on these life force at a homeostasis, at an equilibrium. Any deviation from this results in instabilities in the form of diseases. So, homeopathy as a gentle, safe, individualized system of medicine comes here to aid the instabilities during transition of women at different phases of life. So homeopathy as a therapeutic method is capable of preventing these instabilities and promoting biopsychosocial health in women by similarity, aiming at cognitive gain and a holistic well-being. What does it mean by here similarity? We knew that homeopathy is based on the principle of similia similibus curantur. So, the homeopathic medicines strengthen the body's natural defense mechanism. So here, the therapeutic process enhances awareness, self-regulation, and adaptation, thereby promoting a healthier balance between the mind and the body. A holistic approach here means physical, psychological, and social well-being. So, addressing an integrated approach and integrated as a whole is the holistic approach. So, when we are talking about health through homeopathy, we can't forget the principles laid by our master, Dr. Samuel Hahnemann, in the Organon of Medicine. The repository of knowledge accumulated by Dr. Samuel Hahnemann in the Art of Organon of Healing contains the principles that underlie the homeopathic therapeutic method, which focuses on understanding the initial cause of the disease. In Organon, Hahnemann has emphasized that treat any disease effectively, we must first understand the initial cause. What he called is an antecedent or an etiological cause. And we knew cause always produces an effect. If you want to remove the effect, you have to remove the cause. So by addressing these underlying causes, homeopathy aims to restore harmony and prevent recurrence of the diseases. So here the most important, we are not only curing the diseases with an holistic approach, but we are trying to prevent the recurrence of the disease, which is quite troublesome for the patient. Coming to our subject proper, the transitions of womanhood, the first and foremost is puberty. So what are the challenges which are encountered in puberty? So here we knew puberty is an hormonal surge. So with the onset of hormonal surge, the menarche, there begins menstrual irregularities, dysmenorrhea, acne, mood swings. Besides, nutritional deficiencies like iron, calcium, and vitamin D are also seen. Emotional instabilities, peer pressure, lack of reproductive health awareness. So these are the challenges. And the fourth one that I would say here is a lack of reproductive health awareness, because still our curriculum lacks, or there is a loophole in getting aware of the sexual education. So the reproductive health awareness is quite a loophole in our curriculum, school curriculum. So what are the preventive measures here? A balanced diet and exercise, screening for anemia and thyroid disorders, menstrual hygiene and education, counseling for body image, self-image and self-esteem, health education in schools. So this is very important. We give a proper health education, or in the form of or the reproductive or the sexual educations at schools. So the pubertal transition and homeopathic approach. So this pubertal transition is marked by constitutional sensitivity and hormonal awakening. They are heightened at puberty. The soric tendencies, predispositions to functional disturbances, they are often surfaced at this time. So here what happens, two important benchmarks that we have to remember during pubertal transition. One is the constitutional sensitivity, and the another is the surge of the hormone. The hormones are at their peak during these pubertal transitions. So here the sora, the miasm, which was in latent phase, there is every possibility that these miasm awakens. It comes to the surface. So we can see the Hahnemannian aphorism 94 and 95, which mentions a detailed observation of mental and emotional symptoms. So pubertal instabilities like the mood swings, the self-esteem issues, they all should be addressed constitutionally. So Hahnemann has emphasized an early eradication of miasms in his aphorism 78 to 80 in order to prevent chronic diseases like PCOS, dysmenorrhea, and acne. So the pubertal transition, which is marked by constitutional sensitivity and hormonal awakening. And here there is an outburst or surfacing of the sora, which was in a latent phase. Hence, here a constitutional approach through homeopathy coupled with anti-miasmatic drugs or eradication of the miasm is essential, so as to prevent the complications. Or else this pubertal transition, if it lands with instabilities, there is every possibility that in future the woman is, or the girl is likely to suffer with PCOS, dysmenorrhea, acne, and further the miasm enhances from soric phase, it turns to psychotic and syphilitic phase here. So what is the therapeutic approach during the pubertal transition? An individualized constitutional remedies. And we have good remedies which really does wonders. To name a few, we have pulsatilla, calcarea card, sepia, and many more remedies which can be given during these pubertal transitions. The aim of this constitutional therapy during pubertal transition is to regulate endocrinal functions, to improve the nutritional assimilation, and to support the emotional well-being of the girl. At the same time, it prevents progression into chronic pathologies and thereby strengthens the overall vitality. So if I say about pulsatilla, one line, it's indicated for irregular menses with girls who have a weeping tendency and hormonal imbalance. Pulsatilla, sepia, and calcarea card are boon for hormonal imbalances. So sepia is known for early menstrual disturbances with irritability and pelvic congestions. And calcarea card, the classical fatness without fitness, with the delayed menarche, anemia, and because it has poor absorption. So once you give calcarea, it helps in or it regulates assimilation and absorption of the nutrients in a very defined order. So after these pubertal challenges, let us move to the reproductive challenges. So during the phase of reproductive maturity, what are the challenges we encounter? Here we have menstrual disorders like PCOS, dysmenorrhea, fertility issues, they pop up here. So if the pubertal challenges are not met sufficiently in a holistic manner through homeopathic medicines, then there is every possibility during the phase of reproductive maturity, the woman lands up with fertility issues, recurrent infections, the risk of STDs, sexually transmitted infections, and human papilloma infections, contraceptive needs, emotional and psychological instabilities, stress of higher education, career, and family roots. So how can we prevent these reproductive maturity challenges? It's by a regular gynecological checkups, human papilloma virus vaccination, pap smear, stress management with yoga, mindfulness, meditation, a balanced nutritional diet, and modification in lifestyle. This is very important because nowadays most of our diseases have popped because of our lifestyle. So the so-called modern lifestyle is giving away to many of the hormonal disturbances. Awareness on safe sexual practices, fertility and family planning counseling. So the reproductive stage transition and homeopathic approach. So here the aphorisms 72 to 74 explains that most chronic diseases arise from the fundamental miasm, sora, psychosis, and syphilis. In women, during a reproductive maturity, these latent miasms may manifest as menstrual irregularities, infertility, fibroids, or recurrent infections. So what is the impact of emotions? So aphorism 208 and 209 describes the emotional shocks, the griefs, the disappointments, the suppressed emotions, which significantly influences the woman's physical health as well as the hormonal health and thereby the reproductive functions of the woman. So this is here clear. That is the miasm which was only sora in the pubertal surge has now come with additional psychosis and syphilis. And they now here infertility issues, fibroids, fibroadenomas or recurrent infections. So these all problems start with. And not only this, at emotional level also, okay, we can see how the problem crops. So what is the preventive and treatment goal of this? It aims at both supporting the constitution as well as clearing the latent masses. So restore hormonal balance, strengthen the immunity, support reproductive health, fertility, a healthy pregnancy outcome, and resist chronic and other gynecological disorders. So once we give the proper treatment, a holistic treatment with anti-miasmatic drugs coupled with constitutional drugs, in this phase, we can eliminate many of the chronic diseases. So what is the therapeutic approach for this? Here we have a good set of remedies for this reproductive maturity transition like sepia, lachesis, natrum muriaticum, and folliculinum. So sepia is known for pelvic congestions with hormonal imbalances and the emotional indifference here. That's very important. So lachesis, which is known for premenstrual syndrome, and many of the complaints like left-sided, it could be a fibroids or fibroadenomas and an emotional instabilities. So natrum muriaticum, which is known for bottled up emotions, suppressed grief, irregular cycles, and they have more tendencies towards anemia. So folliculinum, which helps in regulating the ovarian function. It is very beautifully used in PCOS and even infertility issues. Coming next to the pregnancy and postpartum challenges and the homeopathic guidance in this phase of transition. So here, the symptoms that commonly we come across during pregnancy like morning sickness, anemias, backache, physical stress and complications like gestational diabetes, hypertension, preeclamptic toxemias, emotional issues in the form of anxieties, depressions, fear of childbirth, or even it could be postpartum blues. So a pressure, stress at social and families levels, and it could also result in some lactational issues also. So what is the homeopathic approach here? So timely intervention ensures a safe pregnancy, smooth labor, and emotional stability for mother and child. Here in aphorism 5, we see the physician must identify and remove the maintaining cause. So that's very important. So whatever is supposed to be a maintaining cause, that has to be holistically removed through homeopathic medicines. In pregnancy, the very common maintaining causes like it could be a nutritional deficiencies, it could be the emotional stress or the environmental factors which has to be managed. So aphorism is the totality guides remedy even in pregnancy. So aphorism 95 and 94 and 95, it says observation of peculiar symptoms, examples like cravings, nausea, mental states, we can hit a very good remedy by taking the PQRS symptoms of the pregnant lady and thereby go for constitutional remedies. So aphorism 284 and 285, it says avoid suppressive or harmful measures relevant in safe pregnancy management. This is very important. In order to manage pregnancy in a very safe way, let us not suppress any of the sickness that occurs during pregnancies, or else it will surely result in adverse effects in the babies, in the fetus. So homeopathy in pregnancy and postpartum. Pregnancy and postpartum are critical transitions where the physician's role is to ensure safe pregnancy, smooth labor, and emotional stability. Homeopathy helps manage complaints support emotional well-being, and prepare women for smooth delivery and postpartum recovery. So here we have remedies which are excellent, which can be given without any adverse effects, unlike the conventional medicines during pregnancy and even lactation. They are very safe medicines which can be given during pregnancy, postpartum, and lactation periods. To name a few, we have Naxmomicas, especially for the GIT upsets during pregnancies, or mental irritabilities. Ipecac we have especially for, you can say, morning sickness, persistent morning sickness. We have a good remedy there, Colophyllum, which helps in normal labor, and it also enhances the tonicity of the uterus. It prepares the uterus for the labor pains. We have Vernica, which is a boon for any traumas. Even the post-delivery soreness can be tackled with Arnica, and Pulsatilla is a good remedy for any lactational issues or emotional dependence or postpartum blues. Coming over to the menopausal challenges here, we have here hot flushes, night sweats, osteoporosis, joint pains, mood swings, depressions, increased risk of cardiovascular diseases apart from this, we have osteoporosis, the mood changes. These all are the expressions of susceptibility. So we say once there is a decline of estrogens, there is a susceptibility and vulnerability of the woman to get exposed to osteoporosis, osteoarthritis, cardiovascular diseases, hypertension, and angina. So these all are the expression of the diseases which comes because of the decline of hormones, estrogen. Apart from these hot flushes and all we encounter, what are the preventive measures? Hormonal therapy. So, if whenever indicated, like how we have the hormonal replacement therapy, RCTs in allopathy, also we have RCTs in homeopathy without any side effects. So, regular exercises and weight management, calcium and vitamin D intake, screening, mammographies, bone densities, and pap smear, because there is every risk of getting contacted with various types of cancers, CA breast or CA cervix and all. Hence, screening is mandatory, and beside counseling and a support group is essential. So coming here to the climacteric and menopausal homeopathic perspective. Hahnemann considered aphorism 9 and 11 the vital force which gradually declines with age, leading to natural changes and vulnerabilities. So aphorism 260 and 261, which says avoidance of harmful regime, stimulants, unhealthy habits. So this is very important. So during climacteric and menopausal phase, the women have to be very vigilant in their regime. They should always avoid the harmful regimes which were anyhow tolerated by the capacity of the estrogens. Now, because the estrogens are at the declining phase, so you have become vulnerable, and hence you have to now regularize your regime. You have to be very you have to get some healthy habits and avoid stimulants, nicotines, or any other stimulants. Those all should be avoided. So the preventive role. At menopause, the wrong lifestyle choices can worsen the physical and emotional instabilities and further aggravate the menopausal problem, because menopause is a physiological phase which already has lots many of symptoms during its transition. If care is not taken, and the lifestyles, junk foods, unhealthy lifestyles, unhealthy sleep patterns, if they are continued, then it will further add fuel to the fire. So here, homeopathic remedies, they help in managing the emotional changes like anxiety or irritability, as well as the physical complaints like hot flushes, sleep problems, and joint problems. Thus, homeopathy supports women in maintaining harmony and dignity during the menopausal transition. So, the inferiority complex that women's crop during menopausal phase can be dignifiedly tackled through homeopathic medicines. So constitutional remedies here, they are gentle dynamics to balance the mind and body without suppressions. And they also prevent chronic pathologies in the menopausal phase. Chronic pathologies like if the menopausal phase is not tackled or suppressed by using some of the other medicines, then there is every possibility that they may land up with cardiac emergencies, they may land up with neurological deficits and all. So hence, a constitutional approach to climacteric and menopause is very important. So here we have a set of remedies like lachesis, which is known for hot flushes, talkativeness, intolerance to tight clothing, sepia with a bearing down sensation, indifference, and hormonal imbalance, sanguinaria with menopausal hot flushes and right-sided headaches, calcarea with osteoporosis, prevention, and bone weakness. So especially the osteoporotic bones, calcarea would be a very good solution. So is it all clear? Yeah?
Yes, ma'am.
Shall I proceed?
Sure, ma'am.
Yeah, thank you. So here, what are the Hahnemann's preventive philosophy? So true prevention lies in, as per Hahnemann's organon, we have here eradication of miasm, then constitutional strengthening, a modification in lifestyle and regime, and a holistic mind-body approach, a holistic mind-body harmony. Thus, instabilities at each stage can be prevented through constitutional prescribing, miasmatic treatment, and a lifestyle guidance. So here, what is the role of lifestyle in prevention and what is the role of homeopathy? We shall see here. So regular exercises, yoga, walking, a healthy diet which is rich in iron, protein, calcium, stress reduction techniques, avoidance of smoking, alcohol, junk food, and routine health checkups. They really enhance the quality of your life and they keep the diseases at every transition phase of woman's life at bay. So what is the role of homeopathy here? Homeopathy, the safe remedies for menstrual irregularities, menopausal complaints, emotional disturbances, with a holistic approach to mental and physical health, with complementary role in lifestyle modifications. So here, to conclude in a nutshell, the woman's health instabilities are preventable with awareness, education, and timely intervention. Each stage requires a different focus of prevention. Multidisciplinary approach, diet, exercise, medical care, counseling, family and community support. Homeopathic implications with attending constitution, medicines, miasms, environment and mental state at every stage of biological transition of women. So, an overview of this Hahnemann's organon, an overview. Let us see here how to prevent the woman's instabilities by general principles and by preventive philosophies. So restoration of health and study the exciting or the maintaining cause like miasms or hormones or lifestyles or emotions. Then maintain a harmony of the mind and body in order to be healthy and balance the vital force because the root cause of the disease would be an imbalance in the vital force, and hence you need to balance the vital force or the life force. So preventive philosophy strengthen the constitution of the individual, and then they maintain a balance between the body and the mind, eradicate the miasm whichever is surfaced, and a healthy regime through diet, exercise, and nutrition. Is it okay? Shall I go for one case presentation?
Yes, ma'am.
Yeah. So this is a case presentation here with the objectives, appropriate history taking, examination, evaluation, investigations, planning the management, and regular follow-ups, and the consent form. Okay, I'm just giving an overview of this, not the complete case. So it's a clinical case summary of a 30-year-old female with primary infertility, menstrual irregularities, emotional stress, and personality traits. So patient's profile, this is Mrs. X, who is 30 years old, resident of Kalaburgi, with a history of 4 years of married life, unprotected intercourse. There is no contraception usage. Chief complaints, primary infertility since 4 years, irregular menstrual cycle, 35 days since she started her menarche, and bleeding is since only for 3 days. There is history of dysmenorrhea before the onset of menses, and it subsides after 2 days of the onset of the menses. So there is leukorrhea after menstruation. Past history is nothing significant in terms of medical or surgical. There's a family history of hypertension in her mother. Life space, she's the only one child. She belongs to upper middle class, and she's a faculty for science in the college. She is pampered, highly qualified, lives with her in-laws. So marital conflicts, financial stress because her husband has lost the job, and anxieties regarding infertility. So these all are the issues that she is suffering from. So she is anxious because she, after 4 years of married life, she is unable to conceive, and beside the financial stress she is having, and because she is the only single daughter, and now facing some problems in the in-laws. This is so mental and emotional state, fearful, anxious, worried, violent anger, self-injuries. So here what she says is because now she can't say anything in front, and what she does is just bangs her head to the wall. uh, of course, she was stubborn, and so, yet now she has become very sensitive to criticism, and she has a childlike innocence. That is what she says. She always thinks good for others and all. She don't have any malice, any wickedness. That's a very important thing here. So examination height is 163, weight 68, and BMI is 26.5. So a slight overweight she is actually. So bowels constipated, abdomen is bloated, soft, non-tender. Systemic examination reveals no abnormalities. So investigations, the urine test negative. So whenever she because once in 35 days she has her cycle, but still she is so much optimistic. She was expecting that no sooner she crosses 30 days, she goes for urine test, in spite knowing that there is a delay every time in her cycle. Anyhow, the thyroid profile is normal. Follicle study is also normal. USG reveals PCOD with right hydrosalpinx and POCs. Her husband's semen analysis is normal for count and motility. So there is no history of any erectile dysfunctions in the husband. So it's diagnosed as a primary infertility associated with PCOD and right hydrosalpinx. So contributing factors here is an hormonal imbalance, which is coupled with stress. So this is her report, which is done on 30th of August, 2024, wherein there is a right-sided para-ovarian cyst and right hydrosalpinx. So hysterosalpingography done. Yes, what is hydrosalpinx? Let me just brush the mind. Hydrosalpinx is a condition that occurs when the fallopian tube is blocked and fills with serous or a clear fluid near the ovaries. The blocked tube may become substantially distended, giving the tube a characteristic sausage-like appearance. The condition is often bilateral and the affected tubes may reach several centimeters in diameter. The blocked tube causes infertility. Some patients have often recurring lower abdominal pains or the pelvic pains, while others may be even asymptomatic, like in this case, unless otherwise she underwent investigations, there was no as such pains. So this is the result of repertorization, wherein we have taken into consideration the symptoms. This is the result of repertorization. So here I have selected her pulsatilla because during her pubertal transition itself, okay, no proper treatment was done, which is the cause. And I took that into consideration. We have to clean right from the pubertal phase, okay, or we have to plan the treatment in such a way that the ailments from puberty, it has come, okay. So I selected pulsatilla, and beside, because it's a hydrosalpinx tubal blockage, so we have advised even Silesia 6X. As an intercurrent, Thuja was given. If at all, whatever adhesions, okay, occurs at the tubal level, so that would be better tackled with Thuja. And then on 3rd of October 2024, for her first visit, 3rd September, with primary infertility and weakness. And 3rd October, there was improvement in her health. That is, now she has started eating more than one chapati. That was, she has said. And then the bowel movements have improved after a month. Okay. And the menstrual pain that would come, it has subsided now. So the weight which was 68, then it has come to 65. Anyhow, 3 kgs reduction in the weight it has come. The most important thing was she was able to conceive. Okay. So history of amenorrhea since 1.5 months, that was the LMP was 27th of December 2024. She has started the treatment in the month of September, and December was her last menstrual period. So she has conceived. I'll just show the report. Yeah, so this is the USG done on 29th of December 2024, wherein the right ovarian cyst is persisting, but the hydrosalpinx, it has disappeared. The blockage has disappeared, and this is. So this test was done on 31st January, wherein it was negative. Okay. And on 7th February, she got it done. And here we have positive here. Yeah. So it's a positive here. So it was a normal pregnancy of 4 weeks. Yeah, 6 weeks it is. 6 weeks and 4 to 5 days. So this is how she could conceive, and even she has delivered a normal baby. So what are the homeopathic medicines for primary infertility here? We have a set of remedies depending upon the different transitions, the transitions at puberty, the transitions during the reproductive maturity, or depending on this, we have a set of remedies. Like for Infertility because of irregular menses, PCODs, we have pulsatilla, we have sepia, we have lachesis, and we have Apis mellifica. Of course, Apis also is a very wonderful drug which has given good lot of results in infertility cases. And because of tubal blockage or hydrosalpinx, we have hydrastis, which is again very good remedy. We have Kalikat and we have Siliciae. And infertility because of anovulatory cycles, hormonal imbalances, we have here folliculinum, oophorinum, and natrum muriatic. Is because of downs or psychosomatic causes, we have ignitia, stepicyclia, and orometallic. And these are the leaders of constitutional remedies for infertilities like calcarea carb, sulfur, lycopodium. And beside the nosodes, which helps really in solving the infertility problems, are tuberculinum, medorinum, syphilinum. These are the nosodes. Of course, medorinum is a very good medorinum and tuberculinum, which is a very good answer for all infertility cases, many of the infertility cases. So final takeaway, the ultimate mission of homeopathy is promoting the balance of vital force of woman, respecting her choices, endowing her with reason, and allow her to fulfill the highest purpose of existence, that is motherhood. Awakening her feminine energy to be able to promote healing, connections, and empowerment. So my sincere acknowledgement to Homeo 360 team, Dr. Noori Ali, Dr. Mohit, and entire participants, okay, for your patient listening. If you have any doubts, I would be pleased to learn from you all. Thank you.
Thank you so much, ma'am, for such an excellent presentation. You have explained this very important subject of women's instabilities with remarkable clarity and wisdom, drawing from your years of experience. The way you connected both the homeopathic approach as well as the general perspective was truly an insightful and enriching thing for us. I can see a question coming from our audience.
Yeah.
The name is not mentioned. They're asking, in case of pregnancy, a patient comes to us, they are generally very susceptible. What might be the preferable potency and repetition that is safe? Then we go ahead.
Okay. Usually I begin 200, 1M, and 10M very rarely I give, but 200 and 1M are my comfortable potencies for prescription. Yeah. Of course, in other cancer cases and all, I use 50 millisiemal, but in pregnancy, I don't take the risk of 50 millisiemal's and all. I have not ventured in that. I usually give 200, 1M, and 10M to some extent.
Right, ma'am. I hope the audience is really, having wonderful experience. I would like to sincerely thank our wonderful audience for patient listening and giving their valuable time. And before we conclude, I warmly invite our audience members who wish to share their knowledge. Homeopathy 360 is the right platform to connect, contribute, and grow together in homeopathy. Once again, thank you so much, ma'am.
Thank you.
All right. Good night, everyone.
Good night.